created a system which is called Apple's Health and Apple's Research Kit. Who of you in the audience owns an iPhone? Please raise your hands, please. Thank you. That's a fair bunch of people. Who of you has switched off Apple's Health? Like NS4, 5, 6 or something like that. So Apple is slowly but gradually creating the biggest personal health record in the world, actually. Don't be scared. It's on your phone, just like the FBI case showed all of us, so it's secure. But still, just imagine if you could use that and leverage that to do research with it. But not only by researchers, but also by patients. And that's exactly what we wanted to do. So I asked my team to explore the possibilities of using Apple's Health Kit at first, and also the newly launched Science Journal from Google in the next months, to put research options in the hands of patients themselves, to crowdsource and crowdfund it. So I would like to call Thijs Zondag to the stage, one of our Reshape team members, to take you on the hand on this. Thijs.
Thanks, Lucien. Thank you, Lucien. As Lucien told already, there's a major shift going on. And from today, everybody can be a medical researcher. Last year, Apple launched ResearchKit, a platform to develop apps that lets iPhone users participate in medical research. The potential of this platform is huge. Just an example. The Empower Parkinson app study recruited 8,000 participants in a week. A single week, a process that normally takes up years. ResearchKit is really great if you know how to code. Unfortunately, not all patients are developers, nor do they have the resources to hire one. And that's why we developed Reach. Reach is an easy-to-use application that we developed in collaboration with patients and researchers that enables everybody to be a medical researcher. Let me walk you through the actual application that we created. So, a patient can set up a study by means of a simple drag-and-drop system. It's super easy. Did you see what the kids did this morning? That was hard in comparison to this. So, the result of all this dragging and dropping is a piece of raw code which can be built into the generic Reach application or into a new or existing application. By means of charging a couple of euros for the application, the patient or patient organization is able to crowdfund the needed money to hire a trained researcher to work upon the data. So, the application is in the store, people start downloading it, and people can simply enroll in the study. Let me show you how this works. So, people simply sign off the permission to use the data, filling some questions, give answers to some other questions, perform active tasks, such as memory and hearing tests, and giving access to the healthcare data. This healthcare data is provided by means of HealthKit, where Lucien talked earlier about, and uses the data from other applications and wearable devices out there, such as watches, scales, and wristbands. The data of the application can be stored on a Radboud GMC server or on a server provider of your choice, such as TeamScope, which will be on stage next. After the study is finished, the researcher can simply download the data and start analyzing immediately. And that's basically how simple it is. Keep in mind that for now, we have used Apple ResearchKit, but we will be using other platforms, such as Google Science Journal, to make sure we're available on Android as well. And that's Reach from Reshape. Thank you.
Thank you, Thijs. The thing that we're trying to do is to bring the research in the hands of many, so not only for researchers, but also, of course, for patients. And the team has done a great job. Tom van der Belt, Robin Hoyer, Marleen van Gelder, and Thijs, together with Michel Bougereau, created this platform within the blink of an eye. Today, we're launching this in the beta form. If you go up to the website, where you also can contribute to get the data, for instance, into our Epic system as well, the first 100 applicants can start to roll out the beta program. And as you can imagine, patients first. So I think the researchers have to wait a bit, to be honest, for that. Again, thank you very much. And I think Anna's next.
Excellent. Well, here we have Thank you, thank you. I'm not presenting. I would love to present my startup here today, which I do have it at the back of my pocket. But no, I'm going to introduce you to our next speakers. One of the startups, TeamScope, is Diego Manchega. He is passionate, as everyone is now, but he's really passionate, he says, about actually making researchers work more effectively with the data. And he has some great solutions for that. Interesting thing about Diego is, I ask, where are you born? Chile. Where did you live? Argentina, US, Philippines, Kenya, Holland. So I think we have really a citizen of the world here. Please give a very, very warm applause to Diego Manchega, please.
When the internet was first created, its purpose was to make the transfer of knowledge easier. And many positive things have come along since then. We can see that disruptive new technologies have become cheaper. Mobile communication is accessible to everyone. And last but not least, access to the internet is even considered a basic human right. Okay, I'm sorry. Right. At the same time, transparent, but while at the same time safeguarding data integrity and security is a step forward in giving researchers a tool to make better data-driven decisions for their patients and community. In a world in which change is mandated by disruptive new technologies, we must not shy away from challenging how research is being done, but make full use of the potential that
Founded Rockstart, which ran already once in Nijmegen in the last year, and 2 next rounds will be up. So please give a warm hand of welcome to Oscar Knepkes.
You wouldn't expect it, but I am currently in my comfort zone. I'm used to speaking on stage. But today I decided to do it slightly different. I have 8 minutes, which I found out yesterday. I'm used to talk like for 45 minutes about what it is to build companies, to help people build companies early stage. And yesterday I found out it was just 8 minutes. This is a personal story. Today it's May 26th, and exactly 14 years ago, I was lying in a bed, unconscious, in coma. Next slide, please. In my business back then, I was a publisher in technology, and I tried to be connected all the time, always on. This is what it looks like to be always on. This was in a hospital in Amsterdam, and I had, next slide please. Next slide please. I had a very, very stupid accident. I don't have the time to go into detail, but let me tell you, it was like euphoria, alcohol, cycling on the wrong side of the road in Amsterdam on a very busy Friday night that was involved. I hit the ground with my head, and I went into a coma, and I had a severe brain injury. Now looking back, I can tell that this was the most important happening in my life. And if I look back right now, I'm really happy and thankful that I'm here to be able to share that story. But I'll try to explain to you what makes it so special. Next slide, please. Next slide, please. I was surrounded by the best people. This was the hospital, the VU in Amsterdam. And looking back, when I was coming back every week, twice, 3 times on the floor, actually, I didn't get hit. I did myself. My wife was next to my bed, as well as the rest of my family, 8 people. My wife was, since she was married with me, responsible for everything that was involved in the decisions that had to be made in this course of what was about to happen. I was on the operating table, for 6 hours or 7 hours. Next slide, please. My wife was given an opportunity. Someone came from the operating room and said, you have 5 minutes to make a decision about the trial that we're doing in this hospital. And this trial